Thank you, Mr. Chairman, and thanks to our witnesses for your superb testimony. I was reminded as a supporter, even though I come from a highly urbanized state, that I've been a consistent supporter of the Farm Bill. And part of the reason for that is it's what the farmlands of the country produce for urban America. But it's also a reminder of how Congress once cooperated on many of those issues. Two champions of that substantial initiative were Bob Dole and George McGovern, who both had shared a common World War II experience with heroism, the two of them. And I think that these conversations that we have about these sorts of initiatives could be a lot less hostile than they become. And trying to find these common purpose and common ground is really important. So let me go to Ms. Kantz for a moment. The Affordable Care Act has really been a success. 20 million more Americans have health insurance, and insurance is based on risk and the sharing of risk. One of the issues that has always troubled many of us has been those states that did not expand Medicaid, and I want to congratulate Oklahoma for expanding Medicaid to make sure that those at the lower end of the economic spectrum have an opportunity to receive health care at an earlier stage of life. It's a good investment in good health care. So the results that you've had, Ms. Kantz, here at Oklahoma have really been positive. Could you briefly talk about how important this step was in benefiting families across Oklahoma?
Absolutely. Thank you, Ranking Member Neal. We estimated in July 2022 that Oklahoma's uninsured rate had dropped below 10% due to the combination of Medicaid expansion and the public health emergencies continuous coverage requirement. In addition to reaching Oklahomans who were in what we called the coverage crater, formerly unable to access either Medicaid or subsidized marketplace coverage, expansion has reached kids who were formerly eligible but whose parents likely didn't know it. In 2022, Oklahoma's child uninsured rate reached its lowest rate ever. Because of Medicaid expansion, Oklahomans can expect stronger hospitals moving forward, as hospitals in states that have expanded Medicaid are 84% less likely to close than hospitals in non-expansion states. Based on other states' experiences, Oklahoma's hospitals can expect to see less uncompensated care, increased Medicaid revenue, and better financial margins. Roger Kanak is the CEO of Fairview Regional Hospital and a member of my board. Medicaid expansion has allowed his hospital to expand, and a few years ago, his hospital nearly went out of business because it couldn't afford to keep the lights on. We anticipate that Medicaid expansion will have helped our workers keep working. It's hard to tease that information out right now given noise of the pandemic and the data, but other expansion states have found that expansion helped people without a job get one and help people with a job stay in that job. We're no longer tying health care to an employer. We're all better able to show up at work and at home when we can see a doctor and fill a prescription. In terms of our state budget, we have every expectation that expansion will at least break even or save Oklahoma money, because that's the experience every other expansion state has had. Medicaid on the chopping block means people's lives on the chopping block. It's whether a parent can see a doctor and fill a prescription. It's whether the kids with disabilities can see a specialist. My own daughter sees a specialist. We have to drive an hour and a half to see that specialist because there's no other specialist in Oklahoma providing care that she needs. So for us, before Oklahoma was known for having the most successful Medicaid expansion coming out of state question, before we were known for leading the country in criminal justice reform, we were the state with the chronic budget shortfalls. We had 9 revenue failures between 2000 and 2020. So we need Medicaid. We want Medicaid in Oklahoma, and our families need Medicaid. We shouldn't have to decide between going to the doctor and paying rent.
Thank you. I'll just make a quick comment as my time is running low. Not knowing a lot about health care in Oklahoma, I can say this with some accuracy, that those hospitals are heavily dependent upon Medicare and Medicaid. Private insurance pays a very small amount now in our health care system. And the truth is that I think you could say a rule of thumb, it's close to 65% of the money that is allocated from Medicare and Medicaid. And the other point that I want to make about Medicaid is I assume we're going to be discussing it in the next few weeks as we see the Republican budget as well, that a reminder, almost 70 cents on the dollar now goes to nursing home care from Medicaid. It's become a middle class entitlement, which was not its original intention. So thank you, Mr. Chairman.